Ladies and gentlemen, please be seated as we now welcome an invocation by Ms. Annalisa De Pisa.
Good afternoon, everyone. Let us pray. Almighty God, we thank you for the many blessings that you have given us at the Southwest Regional Health Authority. As our nation and the world navigate the changes posed by the global pandemic, we pray that your mighty hands continue to show us your way and give us the tenacity and faith, not just to believe, but to hope for brighter days. Continue to bless our frontline care workers, doctors, nurses, all category of staff, the members of the board of directors, executive management, and our fellow countrymen. Allow this meeting to be fruitful and be a blessing to us all. Amen.
We now extend salutations to Her Worship, Alderman Salima Thomas McCree, Mayor of the Borough of Point Fortin, Chairman and members of the Board of Directors of the SWRHA, Councillors and Aldermen of the San Fernando City Corporation, Point Fortin Borough Corporation, and other regional corporations, the Chief Executive Officer, Executive Managers, and staff of the SWRHA, members of the media, ladies and gentlemen, good afternoon. It is a privilege to extend a warm welcome to you on behalf of the Board of Directors, management and staff of the SWRHA, the Southwest Regional Health Authority. My name is Jason Ganpat, Manager, Health, Safety and the Environment at the SWRHA, and I will guide the process through this afternoon's exercise. May I take this opportunity to introduce the members of the Board of Directors of the SWRHA. Mrs. Valerie Alaine Rollins, Chairman of the Board of Directors of the SWRHA. Ms. Giselle McFarlane, Deputy Chairman of the Board of Directors. Mr. Derek Smith, Director. Ms. Jennifer Marichou, Director. Dr. Malachi Ujuru, Director. Ms. Adele Acosta, Director. Ms. Summer Sandy, Director. Dr. Stuart Smith, Director. Mr. Frank Gittins, Director, joining virtually, and Dr. Brian Amo, our Chief Executive Officer of the SWRHA. Also joining us are former Chairman of the Board of Directors, Dr. Alexander Sinanan, along with former members of the Board of Directors, Mr. Anil Bagauti, Mr. Renny Gosain, and Mr. Stephen Samlal Singh. Ladies and gentlemen, we are coming to you live from the Level 8 boardroom of the San Fernando Teaching Hospital, where members of the Board of Directors are gathered. In an adjoining room are members of the SWRHA Executive Management Team, who are all physically distanced, consistent with the Ministry of Health public health guidelines due to the COVID-19 pandemic. The objectives of this public board meeting are essentially, firstly, to provide a summary report for the previous fiscal year on the delivery of healthcare to the approximately 600,000 persons within SWRA's catchment area, highlighting achievements as well as challenges in the authority's operational and clinical strategies in achieving its targets and goals. And secondly, to afford an opportunity for the board members and executive management in particular to obtain first-hand feedback from you, the public, on what is working well and possible areas of improvement to international best practice that could be realistically addressed. Thank you for joining the authority's virtual public board meeting 2020, the second such meeting being conducted utilizing the full suite of available technology in this time of the new normal brought about by the COVID-19 pandemic. We are living in a rapidly changing world where the only constant is change, but changes generally emerge out of collective dialogue. And in a democracy like ours, the most important consultations are public meetings like this one. You should therefore not underestimate the influence of your contribution. Ladies and gentlemen, if you have questions, comments, or suggestions, please select the Q&A option on your screen and type it in that section. Your questions, comments, and suggestions will be addressed during the question and answer segment. To get the official program underway, may I invite you to view the video presentation of the board's achievement for the period 2019-2020. The chairman of the board will provide additional information on what you have just witnessed in her presentation shortly. I invite you to the SWRHA social media pages to view the achievement video production. Ladies and gentlemen, it gives me great pleasure at this time to introduce the first presenter, Mrs. Valerie Elaine Rollins, Chairman of the Board of Directors of the SWRHA, who has competently guided and inspired the authority over the review period. Madam Chairman.
Thank you, Mr. Ganpat. Her Worship, Alderman Salima Thomas McCree, Mayor of the Borough of Point Fortin, members of the current Board of Directors of the Southwest Regional Health Authority, and 3 former directors, councillors and aldermen of the San Fernando City Corporation, Point Fortin Borough Corporation, and other regional corporations, the Chief Executive Officer, executive managers and staff of the SWARA, members of the public, members of the media, ladies and gentlemen. On behalf of the Board of Directors, it is my privilege to welcome you to the second virtual public board meeting of the Southwest Regional Health Authority to account for the fiscal period 2019-2020. I thank you for joining us this afternoon. Your presence signals your interest and commitment to collaborate in ensuring that we continue to serve you, the population, by improving the quality of healthcare delivered at the facilities of the Southwest region. As many of you are aware, our regular in-person public board meeting has transitioned to a virtual online event due to the continued presence of the COVID-19 pandemic, resulting in a limit on public gatherings and the stringent exercise of public health protocols to ensure our safety. July 2020 witnessed the authority hosting its first virtual meeting, and we are indeed pleased yet again to utilize this platform to engage with you, our valued partners. The Southwest Regional Health Authority comprises the 750-bed San Fernando General and Teaching Hospital, the 100-bed New Point Fortin Hospital, officially opened on July 4, 2020, the Area Hospital Point Fortin, 3 district health facilities at Couva, Princestown, and Cyperia, 2 extended care facilities at Couva and Point Fortin, the New Horizons 33-bed Community Mental Health Rehabilitation Facility at Piparo, and 31 health centers serving a population of approximately 600,000 people in the southwestern peninsula. Over a catchment area which stretches from Moruga in the southeast to Icarcus in the southwest peninsula, and from Freeport in the north to Tabaquite in the east, our conventional facilities have seen an overall decrease of patients' visits during the year 2020. It is noteworthy to mention that the 5 emergency departments under our purview have had 234,071 patient visits in 2020, as compared with 254,489 visits in the previous year, 2019. The annual public board meeting is a mandatory requirement outlined in the second schedule, clause 12 of the RHA Act, which requires the Regional Health Authority to hold an annual public meeting to review the authority's performance in the preceding year and share its plans, goals, and targets for the current year. Today's forum seeks to strengthen our commitment to the effective delivery of health services with care, compassion, and competence by providing an opportunity for us to share information on our goals, achievements, and challenges, and also obtain your feedback. Ladies and gentlemen, as we report on the accounting period of 2019-2020, I need not remind you of the challenges faced as the world was placed in the crossfire of a global pandemic, with Trinidad and Tobago in its direct path, disrupting the foundations of our health system. However, due to efficient planning, prudent and effective management of legislators, policymakers, sector leaders, and the unwavering commitment from frontline healthcare professionals and support staff, we have been able to withstand the turmoil. Notwithstanding the pandemic, SWARA's Board of Directors worked diligently towards strengthening the governance framework to improve accountability and proficiency, providing strategic direction virtually 24/7 for the executive management team and making resources available to successfully achieve the organization's mission through these financially challenging times. The board's 8 committees have diligently provided strategic direction, specific oversight, and technical guidance to the executive management team to inform decision-making for the improvement and maintenance of services throughout SWARA. This governance led to the development of key performance indicators, the restructuring of some administrative processes, the formulation of 20 policies and 12 standard operating procedures, and the development of corrective action plans currently being implemented through the executive management team. Additionally, the board, through its committees, cognizant of our economic constraints and the onslaught of the pandemic, together with the urgent need to improve efficiency and effectiveness, introduce initiatives that accomplish the following: the successful implementation of the COVID-19 parallel healthcare system at 2 newly managed facilities, providing optimal care to valued patients. These new facilities require the board's intervention to ensure that adequate technical, financial, human capital, and logistical resources were in place for their operations. The commissioning in July 2020 at the San Fernando General Hospital of a modern obstetric theater suite, as well as the Neurosciences Center and the Hematology Services Unit, which is the first of its kind in the southern region. The conduct of several clinical audits in key areas of concern, leading to the introduction of new protocols. The commissioning in March 2020 of a new resuscitation room in the emergency department, which allowed for triage level 1 and 2 patients to be appropriately managed. The reduction of medical equipment rental through procurement of surgical equipment, resulting in significant cost savings. The improvement in hemodialysis services through infrastructural upgrades, resulting in the accommodation of 10 additional bed spaces, and increased ventilation capacity through the installation of 5 UVF filters. The introduction of the first of its kind wig station in the oncology suite for chemotherapy patients. The establishment of a neonatal neurology service, the refurbishment and upgrading of the New Horizons facility to become fully operational in October 2019, to accommodate 80 beds for specialized residential, recovery, and rehabilitative service for adult mental health patients. The introduction of telemedicine services to clients all across the services of the Southwest Regional Health Authority. Commissioned a comprehensive review of the parking situation at the San Fernando General and Teaching Hospital campus, resulting in the phased implementation of a new traffic management system and parking plan. The restructuring and refurbishing of 20 hospital administration projects completed through the introduction of innovative measures. The introduction of e-tendering, a first in the health sector. The introduction of an automated system for the surgical waiting list. And last but not least, the implementation of an automated pharmacy services system. Ladies and gentlemen, the Chief Executive Officer will provide you with more details in his presentation on these and others that have been delivered in spite of the financial and COVID-19 challenges. In 2020, the board ensured that high standards of corporate governance were maintained in the organization whilst ensuring that quality improvement standards were sustained. While the theme of the Strategic Plan 2020-2023 is transformation to excellence, the underlying theme for the accounting period was sustainability through transformation. The strategic goals enunciated by the board are to improve the patient-client experience and outcomes throughout SWARA, decrease clinical and corporate risk throughout the authority, reduce the burden of preventable mortality, improve primary health care, including mental health, improve health, safety and the environment and staff satisfaction, reduce wastage and improve efficiency, and adopt ICT as a critical success factor. As you have witnessed, we have made significant progress. However, there is still much more to be done, particularly in reducing the burden of preventable mortality and decreasing clinical and corporate risk and liability. At the Southwest Regional Health Authority, we are all committed to improving the delivery of healthcare services, impacting positively and compassionately on the people we serve. However, the SWARA brand will depend on a cohesive multidisciplinary team in moving forward. It is with this in mind, the board in 2021-2022 is looking forward to the following priorities being addressed, since they are aligned to our strategic goals and will impact positively on both patients and staff. These are as follows. Full rollout of the CARE program, establishment of the health promotion unit, and the introduction of adolescent health and men's health clinics. Introduction of innovative models of community nursing to improve patient empowerment for home-based care. Automation of the health records to address the age problem of misplaced files and improve customer satisfaction. Strengthening and full utilization of the community liaison unit to improve discharge planning and the referral system, as well as tracking of clinic defaulters. A comprehensive review and remodeling of the Department of Medicine. Re-engineering surgical services, including fully automating the surgical waiting list management system and strengthening the pre-OP assessment clinic to reduce the number of surgery cancellations. Introduction of automation to the triage system at the emergency department and the bed management system to improve waiting time at the ED and admission. Achieving the baby-friendly accreditation status. Acceleration of substantive measures to strengthen customer service, including refashioning of our customer care center to improve our response to the public. Full automation of laboratory and radiology services. Completion of phase 2 of the parking and traffic management plan. Operationalization of a cardiac catheterization laboratory, hopefully with assistance from community-based organizations and corporate generosity. A reduction of clinical and corporate risk through the introduction of a coherent enterprise risk management system and full compliance with standard operating procedures to raise awareness of the need for best practice, mitigate the cost of litigation, and decrease the incidence and liability. And last but not least, strengthening the preventive maintenance system. Ladies and gentlemen, soon after becoming chairman of the board in 2018, I stressed that healthcare modernization and transformation with a cohesive team was necessary to improve the SWARA. As a board, with the unwavering support of the Honorable Minister of Health, Mr. Terence Dialsing, we welcome the task of seeking to transform the authority into a state-of-the-art healthcare agency. A significant amount has been accomplished, despite the unprecedented challenges of COVID-19. We are still committed to the goal of becoming the state-of-the-art healthcare agency, and we need your support. Today's virtual public board meeting solidifies the importance of engaging with all our stakeholders along this journey of transformation, since we rely on your feedback in order to strengthen the continuum of healthcare and increase public awareness on the issues affecting the local health sector. I wish to take this opportunity to thank all those who have contributed to the improvement of the services at SWARA, especially our dedicated doctors, nurses, other healthcare professionals, our Chief Executive Officer and Public Health Expert, Dr. Brian Amor, the executive team, managers, heads of departments, supervisors, other frontline and allied staff, engineering, utility, security, sanitation, and all support staff, as well as the external providers to SWARA. For it is through your commitment that we have been able to achieve some significant milestones over the fiscal year 2019-2020. You truly deserve a standing ovation. To the Deputy Chairman, directors of the board, including the 3 former directors, you have given me, and by extension, the SWARA, your fullest support throughout the year as we faced challenge after challenge. However, we give you, the public, the assurance that we will continue to exercise due diligence in carrying out our duties in keeping with our instruments of appointments and the RHA Act. To all non-governmental organizations and corporate partners and the members of the public who provided tremendous support to the SWARA during the most challenging time in the history of public health in this century, when the lives of the people of Trinidad and Tobago were totally dependent on God and the health system under the astute leadership of the government of Trinidad and Tobago, we are thankful to be alive to continue serving you. In closing, as chairman of the board, I again wish to thank you for your presence this afternoon. The CEO will now provide more details focusing on the strategic plan, and we look forward to your valuable contributions. Thank you for your attention. May God continue to bless the Southwest Regional Health Authority.
Thank you, Madam Chairman, for your comprehensive review of the Board of Directors' achievements. To address you, providing an overview of the strategic and operations perspective for the aforementioned period, I invite the SWRHA's Chief Executive Officer, Dr. Brian Armour.
Thank you, Mr. Ganpat. Her Worship, Alderman Salima Thomas McCree, Mayor of the Borough of Point Fortin, Chairman and members of the Board of Directors of the Southwest Regional Health Authority, inclusive of the immediate past board directors, councillors and aldermen of the San Fernando City Corporation, Point Fortin Borough Corporation, and other regional corporations, executive managers and staff of the SWRHA, members of the media, ladies and gentlemen, good afternoon. It is my privilege to share with you, the members of the public and other stakeholders in this second virtual forum, the annual report of the Southwest Regional Health Authority for the fiscal year 2019 to 2020. You would have heard the chairman expound on the authority's strategic board direction and outlined a number of our significant achievements which bore fruit in the previous year. As you may already know, we are the largest of the 5 regional health authorities in Trinidad and Tobago. We serve a diverse clientele of approximately 600,000 persons who reside in a geographical expanse that covers more than 1/3 of the land surface of Trinidad. Unlike other years, the period under review is unique to the SWRHA and can be described as a year of two tales. First, our strategic plan 2020 to 2023, Transformation for Excellence, was approved by the Board of Directors on the 15th of January 2020 and provided a roadmap of our priorities to move our transformational thrust forward. As the second part of the tale, our response to the COVID-19 pandemic, while continuing to deliver our essential services, worked alongside this reality. We spent significant time during this fiscal period in planning towards the implementation of our strategic plan, Transformation for Excellence. We began aligning the activities of the organization under our goals. I will therefore now report on the SWRHA's performance, activities and achievement for the fiscal period 2019 to 2020 and present a synopsis of our future direction per strategic goal. As we look at the utilization for this period, despite the unprecedented year with a pandemic that none of us have experienced in our lifetime, through the efforts of the dedicated SWRHA staff, we would like to report the following. We attended to over 230,000 patient visits to the emergency departments and over 150,000 outpatient visits and over 430,000 patient visits in primary care. We treated over 55,000 patients that were admitted to our wards. We performed over 12,000 surgeries at our hospitals. We successfully delivered over 4,500 babies, and we have seen a continuous reduction in this regard in babies with low birth weights. This highlights the continuum of care between the antenatal services provided in primary care up to delivery at secondary care. We continue to meet international standards with some of the highest rates of immunization uptakes across the globe, with 99% in County Victoria, 96% in County St. Patrick, and 99% in County Caroni South. Free vaccinations are provided to all children to prevent morbidity and mortality from vaccine-preventable diseases. We were able to totally or partially dispense 93% of all prescriptions We conducted and processed over 2.4 million tests, which represents a 60% increase over the previous year. We processed over 200,000 radiological images. As relates to the first strategic goal, which is to improve the patient and client experience and outcomes throughout the SWRHA, which includes secondary and tertiary clinical care excellence, it is to be noted that the emergency department implemented some activities aimed at improvements to the service delivery, improving the patient experience and reducing wait times through re-engineering processes, which were namely 1, creation of separate care pathways, 2, improved triage system and acute care management, 3, improved bed bureau management, which involves the relocation and computerization of bed management, and increasing the provision of health education and patient information through videos. Within the oncology department, a workstation for chemotherapy patients, the first of its kind in the country, was established in this fiscal year. The hours of operation of the pharmacy care were extended so that patients and clients could fill prescriptions at more convenient times. Noting the patient throughput, the SWRHA began work on reorganizing the outpatient clinic system. The new block appointment system was implemented to improve efficiency at our clinics. Our Transformation Trust will see our healthcare ecosystem revolving around you, the patient, as we organize our services around you and your family needs to improve health outcomes. As we continue to integrate the continuum of care between primary, secondary, and tertiary services, therefore, our delivery of care will become more holistic, easier to navigate, and beneficial to you. With respect to strategic goal number 2, which is to decrease the clinical and corporate risk throughout the SWRHA by improved governance, it is to be noted during the period under review, we improved our executive governance structure and established oversight committees as well as multidisciplinary quality circles to provide advice and expertise to support our decision-making. We continued to review and update our operating procedures and policies. At the SWRHA, we understand that inherent to health environments is high risk. Through the adoption of an enterprise risk management approach, we will systematically improve on safeguarding patient safety, organizational assets, our corporate brand, and protect against financial liability. As relates to strategic goal number 3, which is to improve primary health care, including mental health, the SWRHA's 34 primary healthcare sites usually serve as the first point of contact to our health service, with the vast majority of persons requiring no further onward referral or care. Primary health care provides a broad range of important services aimed at preventing illness and maintaining good health by healthcare professionals in the community. These include 1, disease prevention and health education, which incorporates screening with preventative measures. 2, community health services, including non-communicable disease clinics, antenatal and postnatal care, child health and school health. 3, integrated specialist programs, bringing services that were traditionally offered only at hospital closer to patients, and allied health services. As we continue our process of re-engineering primary health care, more emphasis will be placed on promoting health and wellness and disease prevention in harmony with our mission. During the year in review, we established 2 new services within primary care, namely child wellness clinics and smoking cessation clinics, and the Global Hearts Initiative was also incorporated into the primary care system, firstly at the Freeport Health Center, and will be further expanded to other sites. The Health Promotion Committee continued to coordinate and implement several national and regional non-communicable disease risk factor reduction programs under the National TT Moves initiative, inclusive of cancer screening and our culinary medicine project. As it relates to mental health, the New Horizons facility was operationalized to provide specialized residential recovery and rehabilitative services for adult mental health patients. who require additional support and life skills to continue their recovery and transition to community living. The mental health professionals provided care, counseling, and treatment for patients, which amounted to approximately 20,000 clinic visits. Into the future, more specialty services will be placed in primary care settings. This enhanced capacity will improve access to specialists and reduce the overuse of the emergency departments. We will expand and further integrate our mental health services and improve mental health awareness, prevention, intervention, and support. As relates to our fourth strategic goals, which is to improve the health, safety, and environment and staff satisfaction, we build a positive safety culture, therefore, through our stakeholder engagement, enhance implementation of programs that will minimize exposure to health risks, and improve our organizational compliance to legislation. We will continue to recognize and reward staff, support continuous learning, and support their health and well-being. On the fifth strategic goal, which is to reduce wastage and improve efficiency, during this fiscal period, it is to be reported that the SWRHA expended $1.086 billion to deliver quality services to the public. Subventions inclusive of salaries, staff benefits, payment of arrears of increments amounted to $991 million, while goods and services amounted to $200 million. The SWRA operated in this environment with a net deficit of $106 million. The full automation of some of our services, for example, e-tender software and the pharmacy module, has led to realized cost benefits and expenditure reductions. Within the current economic climate, where both minimization of costs and improvement of quality are key aims, the SWRHA will deliver improved stewardship of our resources and better monitoring and evaluation methods to increase our financial health and ensure value for money. While expanding our service coverage, we will streamline and align our processes so that we will be more efficient and cost effective. As relates to the sixth strategic goal to adopt the information, communication, and technology as a critical success factor, the increased use of technology is part of our new normal, so to speak, and the SWRHA plans to keep abreast. We continued to upgrade our ICT infrastructure throughout the SWRHA for this period through the procurement of new servers, relocation of existing servers to improve connectivity, expansion of our wide area network, provision of new software, and significant progress towards the full integration of our enterprise-wide solutions. During fiscal 2019-2020, the SWRHA expanded the use of the Patient Information System, commonly known as SALMA, in primary and secondary care. Information, communication, and technology is a valued strategic asset that will advance our mission. Over the next 3 years, the SWRHA will expedite the automation of our core processes within the clinical, operational, and administrative fields through the full implementation of all enterprise applications to enable more efficient and interconnected care as part of our long-term vision of full digitization. Looking at the facilities in terms of the administration, infrastructure, and operations overview, the SWRHA, as relates to refurbishment and upgrade, procured, installed, and commissioned equipment for use in both the primary and secondary care facilities, namely the operating theater, intensive care unit, the hemodialysis unit, and urology and obstetrics departments. During the period under review, we refurbished the neonatal intensive care unit, the waiting area in the oncology department, and the acute medicine unit in the emergency department. We also improved the cleanliness and aesthetics of the bridge link and repainted the kitchen walls and several other interior and exterior walls of the hospital. As part of our drive to improve the aesthetics of our facilities, restorative and refurbishment works were also carried out on our primary care facilities to improve the safety and ambience at these sites. To update on the security services, the SWRHA developed a traffic and parking management plan, particularly at the San Fernando General Hospital and the San Fernando Teaching Hospital, in an effort to improve the traffic and parking issues that are affecting staff, visitors, and patients. It would be remiss if we do not update through this forum on the SWRA's response to the COVID-19 pandemic. In this regard, the SWRHA proactively and aggressively engaged in the COVID-19 response to provide both preventive infection prevention and control measures, as well as mitigation response measures. The SWRHA's planning and response utilize a multiple department approach using the Hospital Incident Command System and leverage the internal expertise and knowledge that resides within our organization, along with the Ministry of Health guidelines. The following, therefore, will outline some of the activities and initiatives that were implemented and operationalized by the SWRHA in response to this global pandemic. As at the 30th of September 2020, the SWRHA, in response to the pandemic, attended to over 23,000 patient visits for patients who presented with respiratory symptoms at the 5 emergency departments and the 34 primary healthcare centers in the SWRHA. Based on the patient's current address, the SWRHA recorded 1,367 patients positive for COVID-19 as at the end of September last year. The Medical Extension 1 in the early phases was repurposed initially before the parallel healthcare system, and then subsequently the Augustus Long Hospital, a 65-bed facility, inclusive of an intensive care unit, a high dependency unit, and general ward capacity to treat suspected cases of COVID, was used as the national contingency reserve to the then established Couva Hospital. In 1 week, in that emergency response, the SWRA refurbished the laboratory to receive the testing platform technology, commonly known as the PCR test, for the COVID machine. We expanded then the 87 SWRA Customer Service Center into a call center to provide information on COVID-19 related matters, outpatient clinic information, mental health support, and other matters. Telemedicine services were activated and were provided to over 8,000 patients during the period May to September 2020. The SWRHA also distributed 40,000 information flyers in the southern region via the 3 daily newspapers. Over 300 COVID-19 staff sensitization sessions were conducted with practically all our staff in attendance. Sensitization sessions began on the 6th of March 2020, even before the first case at that time, in heightened alert, and continues to be ongoing. Mental health services and interventions were and continue to be provided as intervention to our service users and staff via several modalities, whether face-to-face, telemental health services, mental health tips via SWRA social media platforms, clinics, and health promotion in the various SWRHA facilities. Topics included anxiety, stress, depression, work-life balance, and other essential mental health coping topics. We would also like to present, as the global pandemic is still with us, an update to this response for that fiscal year for the benefit of the public as of the 30th of September 2021, literally a couple of weeks ago. We would like to report further, therefore, that the SWRHA has treated, as of this time, over 35,000 patients with respiratory symptoms and recorded over 16,000 COVID-positive patients as of September 2021. We continue to provide care virtually via the telehealth medicine service in both the primary and secondary healthcare services. There were 26,601 such consultations conducted using this modality. The use of telemedicine has allowed for providing care while allowing you, our patients, to remain in the safety of your home to help prevent the global spread of this pandemic. We conducted over 400 sensitization sessions involving, again, practically all our staff to reinforce, again, our infection prevention and control protocols. And the SWRHA has continued to provide mental health support and intervention to staff and patients. During 2021, there was an increase in COVID-19 cases. For the period March and April, the SWRHA recorded for this period alone 1,249 positive COVID-19 cases. Cases were followed up by the surveillance teams, and contact tracing resulted then in over 6,600 persons being quarantined. Several infection prevention and control, as well as health and safety measures, were further implemented to ensure a secure and safe working environment. As it relates to the COVID-19 parallel healthcare facilities under the jurisdiction of the SWRHA as a contribution to the national effort, in conjunction with the Ministry of Health and valuable partners such as the Trinidad and Tobago Football Association, home of football at Couva, and the University of the West Indies St. Augustine Day Bay campus, treatment and quarantine centers were operationalized. The University of the West Indies St. Augustine Day Bay campus comprises of 4 buildings totaling 70 functional rooms for patients and was started on May the 1st, 2020 with full occupancy for quarantine of 69 returning travelers as the largest state quarantine facility in the country at that time. The TTFA, home of football Couva, of 14 rooms and 80 beds, was at one time the largest facility in the country with peak occupancy of 30 plus recovering COVID-positive patients. From April 2020, the Augustus Lawn was operationalized to support the national response to the pandemic, and during 2021, the Point Fortin Hospital and the area hospital Point Fortin were converted to COVID-19 facilities in the recent surge. The SWRHA has recruited from March 2020 to present a total of 549 persons in our essential healthcare services industry to support the pandemic response, primarily as backfills for our staff pre-COVID pandemic that were redeployed to COVID facilities in order to maintain both the regular and the parallel healthcare system. The molecular lab machine, the SWRHA began testing for COVID-19 in 2020, and to date we have conducted over 52,000 tests. With respects to the SWARA's COVID-19 vaccination program is successfully moving ahead. To date, we have administered 279,231 doses as at September the 30th, 2021. Mass vaccination sites, elderly homes, shut-ins at their private residences, and community outreach locations all refer to this achievement. There are over 118,000 fully vaccinated persons recorded as of the 30th of September 2021. As I conclude, ladies and gentlemen, the aforementioned highlights are just a sample of what we accomplished in the past year. We at the SWRHA are extremely proud of our accomplishments for the reporting fiscal year 2019 to 2020, as we are confident that the changes implemented, oversight provided, and guidance delivered by the Board of Directors redound to the benefit of our valued patients and clients. We were happy to receive 943 commendations from you for this review period, expressing satisfaction with our staff and service. While the pandemic persists, so does the perseverance of the board, the management team, and most of all, the dedicated staff of the SWRHA. We recognize the countless acts of compassion and dedication that our staff, frontline, and others demonstrate each and every day. We express our collective appreciation and admiration to our staff, who showed exceptional commitment and adapted quickly to changes in workloads and working environments, and responded with resolve despite the challenging situation. As we move towards our transformation for excellence, I thank you.
Thank you, Dr. Amor, for that wide-ranging presentation. Ladies and gentlemen, again, I wish to remind that if you have questions, comments, or suggestions, please select the Q&A option on your screen and type it in the section. Your questions, comments, and suggestions will be addressed during the question and answer segment. As you are aware, in October 2019, the SWRHA officially implemented our Strategic Plan 2020 to 2023. entitled Transformation for Excellence, which provides a visionary roadmap for the future. I invite you to now view the video presentation on the strategic plan.
Welcome to the Southwest Regional Health Authority, or SWRHA, Transformation for Excellence. This production provides valuable insight and takes you on a journey of SWRHA's Strategic Plan 2020 to 2023, outlining the authority's vision in developing, improving, and providing an excellent healthcare experience to you, our valued clients, as well as offering a comfortable work environment for our committed employees. At the SWRHA, we strive to offer innovative, quality healthcare in a safe and comfortable environment. With a catchment of approximately 600,000 persons, we account for almost half of the population of Trinidad and Tobago. The boundaries of our region are Freeport in the northwest, Tabaquite in the northeast, Icacos in the southwest, and Moruga in the southeast. Within these parameters, we provide healthcare services at 31 primary care facilities, 3 district health facilities, 2 extended care centers, the New Horizons facility, and secondary care at San Fernando and Point Fortin General Hospitals. The authority has developed a 3-year fiscal strategic plan, which acts as a catalyst for the implementation of innovative solutions, service excellence, and visionary leadership through 4 strategic pillars demonstrated in clinical excellence and quality of care improvement in primary and secondary health care, capacity building, patient ambience, and infrastructural improvement. The development of the strategic plan was a delicate and thorough process driven by the competing demands of offering the best innovative care in all areas with limited economic resources and lower global energy prices. Several diverse stakeholder meetings included clinical, operations, and administrative teams, along with members of the board of directors, executive, management, employees, and patients themselves contributed to the final overlay of this forward-thinking plan. Our core values. This strategic plan is underpinned by the abiding principles in which the SWRHA dedicated staff are engaged to our core role of providing healthcare services. Integrity, excellence, compassionate care, teamwork, respect, organizational learning, accountability, and innovation. Our vision. The SWRHA's vision to become the leading provider of compassionate, cost-effective, premium quality healthcare services. Our mission. Our vision is complemented by our mission statement. We are in the business of promoting wellness and providing compassionate, cost-effective, customer-focused healthcare to the people of the Southwest region within the guidelines of the national policy and ensuring our staff a productive and rewarding environment. At SWRHA, we want our patients to understand their role and expect the best of us as health caregivers. The SWRHA has developed a patient-centered comprehensive plan that goes well beyond 2023. To improve the healthcare of everyone in this region, we placed laser-focused attention on 6 holistic areas important to us. Focusing on these 6 areas point us towards the future to achieving our national vision in accordance with the UN Sustainable Development Goals 2030 and the National Development Strategy. The SWRHA's vision is well articulated through the goals and objectives. Strategic Goal 1. Improve the patient-client experience and outcomes throughout the SWRHA, including secondary, tertiary clinical care excellence. Strategic Goal 2. Decrease clinical and corporate risk through the SWRHA by improved governance. Strategic Goal 3. Improve primary health care, including mental health. Strategic Goal 4. Improve HSE and staff satisfaction. Strategic Goal 5. Reduce wastage and improve efficiency. Strategic Goal 6. Adopt ICT as a critical success factor. By 2023, SWRHA would be able to offer a suite of online services accessible by the touch of a button. This can be achieved after the implementation of 6 strategic goals.
Good morning, everyone. My name is Patricia Smith-Grashi. I'm a primary care nurse manager attached to County Victoria. I have been professionally associated with the Southwest Regional Health Authority for the last 22 years. The strategic plan 2020 to 2023 would provide opportunities for us to strengthen the relationship between primary and secondary care. In this way, we'd have a smooth transition for patients, and in addition, it will reduce the revolving door phenomenon which causes overcrowding at the major hospitals. I am looking forward to be a part of the transformation that will come about with the implementation of the Strategic Plan 2020-2023.
Good morning, my name is Geeta Richardson. I have worked with the SWRHA for 23 years. I'm currently working with the Policy Planning and Research Department as a research officer. Our strategic plan tagline, Transformation for Excellence. This can be achieved by the Policy Planning and Research Department by recording parameters within a health information system for continued data capture and analysis, with emphasis on health service indicators. This can also drive research to inform policy making and practice within the Southwest RHA. I look forward to being part of the implementation of this plan, Transformation for Excellence.
Good day. My name is Andy Adams. I am currently employed with the University of Trinidad and Tobago as a maintenance craftsman. And today I want to let you know about the services of San Fernando General Hospital. Over the last 4 years, I've had to use the services here 3 times, in 2017, and then again in 2019, and in 2020. And I must indeed say to Trinidad and Tobago that the services were more than I bargained for. I just really want to let Trinidad know, because lots of times we have a lot of negative things said, but when we do have the good things said, it is never reported. No one hears about it. So today I'm proud to be a Trinidadian and to be here to represent and let the people of Trinidad and Tobago know, hey, the services at San Fernando General Hospital is world class. I have been very pleased and proud and well served, and I just want to say thank you for the great services I received here at San Fernando General Hospital.
Visit our website at www.swrha.co.tt. Contact us at 225-HEAL or 225-4325. Call our toll-free 24/7 available hotline at 87-SWRHA, that's 877-9742. And like, share and follow us on all major social media platforms.
Indeed, the strategic plan video production has piqued my interest, and I usher you to the SWRHA's social media page if you wish to view it again. At this point, we now enter the Q&A segment of today's meeting. As we are all nudged to become familiar with available technology, please take note of a few important house rules during today's question and answer segment. We will facilitate as many of your submissions as time permits. However, questions, comments, or suggestions not addressed in this forum will be attended to by the Board of Directors. For the purpose of this meeting, questions are limited to 1 per person. During this segment, please press the Raise Your Hand option and the moderator will acknowledge you. Please press the unmute button on your screen when you are acknowledged. Before delving into your question, please provide your full name and the area you reside. Additional questions can be submitted via our email address at virtualpbm@swrha.co.tt. That's virtualpbm@swrha.co.tt. For employees of the authority, please note that all queries or concerns should be directed to the Employee Solutions Desk at the Human Resources Department, and you would receive a response within 24 to 48 hours. It should be noted that this platform is an opportunity to address issues and concerns from members of the public and not just staff of the SWRHA. We now enter our first set of questions. Firstly, we shall receive those questions which were posted to the Q&A section. Our first question: why is the SWRHA hiring staff and administrative departments when there are staff shortages in nursing administrator? Submitted by Mr. Lester Paul. We direct our question to the panel.
Hi, good afternoon. Thanks for the question. The SWRHA has a strategic hiring strategy. So there has been hires in the administrative staff, but there are also hires through all categories. We have 4 key lines of staff: administrative, operations, clinical, and executive. So within the with the fiscal year of reporting, there would have been equitable hiring approaches across all lines of staff as equitably as the vacancies allow. In particular, for the COVID pandemic period, we would have hired in total about close to 200 nurses as far as I recall, and therefore those nurses who are mainly frontline will be regularized, and then through internal interviews and promotions, we would be able to bring nurses up to the managerial tier. So there has been equitable focus across all lines of staff, and therefore that is part of the functions of the Human Resources Department.
Thank you for your response, CEO. Our second question: can SWRHA state how many staff members at the COVID treatment facilities have taken the COVID-19 vaccine?
Thanks again for the question. Even though I do not have the immediate numbers, I could say in terms of general percentages, the uptake has been pretty good, particularly amongst the physicians and support staff. It has been said in the national domain that there are concerns raised by some nurses, but that has been steadily improving. So the last figures I have is at least more than half of the nurses at this point in the COVID facilities have taken the COVID-19 vaccine, and we continue to work with the nurses in this regard to address any concerns that they may continue to have. But we have seen steady improvement, particularly over the last 2 to 3 months.
Thank you again, CEO. Spending for 2019-2020 was $1.086 billion. Can you give a comparison of the previous year? And did the COVID-19 account for the $106 million deficit recorded?
In terms of comparison to the previous year, the expenditure, as far as I recall, is about the same in terms of the monies allocated and the expenditure. COVID-19 would have partially accounted for it, but not fully, because we still have to continue regular services. And that would have indicated, in terms of our previous historical year deficit financing. But in that regard, this is also an improvement in terms of the net deficit for the fiscal year being reported on.
Thank you for the clarification, CEO. And the second part of that question: what challenges would you say challenged the SWRHA the most throughout the pandemic?
In terms of the healthcare system response, I actually think the healthcare workers and the healthcare system has done remarkably well. It's really an admiration to see that everybody has rallied. The challenges has had different phases. The main challenge now is for everybody to get vaccinated, right? So in terms of any information to help you make an informed choice, and anybody who makes a choice to get vaccinated means less hospitalizations, less deaths. With respect to the healthcare workers, executive and the board of directors are mindful how resilient we are, but we want to remind the community they also come from the same community that we serve. We are humans, so therefore issues like mental health, addressing the work-life balance of healthcare workers as the pandemic wears on is a growing challenge. So we do respect and commend the healthcare workers, but we all have to help each other out by getting vaccinated.
Thank you for your responses to those questions from Ms. Cindy Raghubar Singh. We move on to the next question. Are any more hydroponic systems going to be launched at other facilities?
At this time, there are no immediate plans. We have launched one at the San Fernando General Hospital, the Kitching, It is doing reasonably well, but it is certainly something that the Nutrition and Dietetics Department would look at in terms of the success and look in terms of viability of expanding to other facilities later on.
Thank you, CEO. Our next question: isn't the Quality Audit Department a duplication of internal audit?
It is not a duplication. Actually, it is called the Quality Department. And the Quality Department, part of their work involves audit of systems, as opposed to the Internal Audit Department. And based on corporate governance, the Internal Audit Department does not report to the organization by the CEO. It reports to the Board of Directors through the Audit Committee. So it's an independent quality control for any organization, whilst the Quality Department does, amongst audit, other process checks, and that is within the organization that the head of the department reports to the CEO.
Thank you, CEO. And the second part of that question: what measures are being put in place for more hospitalized cases of the Delta community spread at SWRHA's COVID facilities?
Through you, moderator, I've been asked to defer to get an additional response from the Deputy Chairman of the Board with respect to the differentiation between quality audit and the internal audit. So with your leave, Deputy Chairman of the Board.
Internal audit looks at the governance risk, they look at financial statements, and they look at governance through compliance with laws and accounting procedures. So essentially, internal audit really relates to the financial statements and areas around which fraud or inaccuracies may occur, whereas quality looks at the risk that an organization can incur based on the procedures and processes that it uses. So there's a fundamental difference. One is for financial statements and governance of the board, and whilst the other is based on processes that the corporation and the organization incurs.
Thank you for your clarification, Deputy Chair. We revert back to the second part of the question, our previous question regarding the management of the Delta variants. Right. I'll repeat the question. What measures are being put in place for more hospitalized cases of the Delta community spread at SWRHA's COVID facilities?
Okay, well, we would like to say that thankfully, despite the Delta in the community, we have not seen a surge at our COVID facilities. Management of the Delta cases, like any other variant of the COVID, follows our enhanced infection prevention and control strategy. So all staff are suitably trained, and that in collaboration with the ministry, these cases would be managed as a patient, first of all, for any illness. We do know that because of the Delta, there's an increased risk of persons becoming more severely ill, and there is a predilection for more younger age groups. So those preparedness measures are in place. In terms of having staff available to treat pediatric cases, as well as to treat and manage persons identified as Delta with our strict infection prevention and control measures. So the system is not overwhelmed, and our staff are trained, and we have the capacity at this point.
Thank you for your response, CEO. Our next question: what is the SWRHA doing about drug shortages at its pharmacies, particularly cancer drugs? This question has been submitted by Ms. Radhika De Silva.
In terms of the shortage of any pharmaceuticals, this is worked in collaboration with the Ministry of Health. And in terms of shortage of pharmaceuticals, there's of course alternative treatments and alternative modalities of treatment. So there is resilience and some redundancy in the system, such that drug shortages can manifest in alternatives. And any absolute shortages, we normally work closely with the Office of the Chief Medical Officer and other stakeholders to resolve. So overall, patient care has not been found to be compromised to a great extent to disrupt patients' health or well-being or our health service in general at this point.
Thank you to you for your response. Our next question, how often is the Point Fortin Hospital sanitized?
I would like to say it is not a matter of how often it is sanitized, but it is following our infection prevention and control policies and protocols, and it is also determined by the level of exposure risk. As a COVID facility, all infection prevention and control sanitization measures are in place. How often can be anywhere from as soon as you use a high-touch surface to every hour as the situation demands. What we measure as outcomes is that thus far there has been no spread of the infection within the facility due to any poor or suboptimal IPC practices. And the SWRHA is very firm and very strong and has results to show our infection prevention and control practices in our respective unit is second to none.
Thank you for that comprehensive overview of the response, Dr. Amo. Our next question, are the numbers of Venezuelan mothers on the maternity ward increasing? Is that information you can provide?
I do not have the immediate information to provide, so therefore we could certainly address that as set to the board of directors. The issue of Venezuelan migrants or any migrants, that is an issue that falls under our non-national policy, and therefore as an essential service, we treat anyone who requires, according to our policies, essential services, and it does not come at a displacement to any of our nationals, whether they be residents or citizens. But I would like to defer to the Director of Health who wants to offer an additional response to this.
You now welcome the Director of Health to respond.
Thank you, Directors. So currently at this time, no, we have not been seeing an increase in the numbers. We have had a steady throughput, but there's been no significant rise in the numbers presenting at this time.
Next up, our next question, are there any plans to establish a palliative care unit in the South?
The short answer is yes. I would also again ask the Director of Health to provide any further information.
Yes, so the palliative care services, we have had discussions and there were plans to, pre-COVID, to establish a palliative care unit at the area hospital. Because of the onset of COVID and we had to divert resources, that has been on hold, but yes, certainly that is part of our plans to address the concerns of our oncology population. Yes.
Thanks to our Director of Health for that response. Next, what we have is a comment. The presentation was professionally done and it was very clear and precise, submitted by David Kahn, Father David Kahn, my apologies, for Father David Kahn. Thank you, Father David Kahn, for your comments today on our presentation. Next, we shall open the floor for live questions from the audience. Please remember to raise your hand and we would acknowledge your position and ask you to pose your question to the panel.
Hi, good afternoon, everyone. Cindy Rababa, Singh, TV6. Not sure if the Director of Health could just explain a little bit, but when he said there's not been an increase in patient numbers of Venezuelan migrants, could he give an idea as to what that number is like at this point? And as it relates to migrant mothers, I'm not sure if you can also give a figure of that because we've had complaints from, I know the CEO would have said, nationals aren't displaced, but there have been complaints that the number of migrants do affect the quality of care that locals do get. So if we could just get a little bit more information on that, if possible. Thank you.
You want me to answer? You want me to? Okay, thank you for the question. We have had very few Venezuelan mothers presenting, and they have not significantly impacted on the quality of care that is available to our locals. We have had complaints and we have investigated them, and we have found that there's no evidence that we are adversely affecting our Venezuelans or Rwandan nationals. They've all received the treatment that they required, and we have found no evidence that they were denied treatment or care, as the complaints had stated.
Thank you for your question and response. Welcome and good afternoon. We invite our next interviewer. Please unmute your microphone and present your question to our panel. Please be reminded, if you would like to raise a question, please raise your hand and we will address accordingly. Okay, we have a hand raised from Ms. Radhika Sukraj. We kindly welcome a question from yourself, Ms. Sukraj. Please unmute your mic and present your question to our panel.
Good afternoon. You all hearing me?
Yes, we are.
Okay, so I'd like to find out how many nurses are on temporary contracts and who may have to be normalized. And also, your budget, is it allowing you to run both normal and parallel systems, or will you have to seek further subvention from the ministry?
For the question, based on efforts with the nursing personnel and the human resources department, as we speak today, there are no nurses on short-term contracts, if I understand the question correctly. Everyone has terms of conditions of contracts that range from a minimum of 1 year to 3 years, and a sizable majority of our staff are actually permanently employed at this time at the Southwest RHA. With respect to the budget, yes, the COVID pandemic was unprecedented during a period of time, and we have collaborated with the Ministry of Health to provide the necessary contingency funding that was also stated in the national domain, not only to the ministry but other sectors. As COVID pandemic wears on, and we too have adapted to the global fiscal realities, we are looking at internal efficiency measures in order to, again, according to our strategic plan, reduce wastage and improve efficiency. So there can be internal recoup savings, and that is being appropriately applied. So we are managing with the subvention we have gotten from the government purse to the Southwest Regional Health Authority to manage both systems at this time.
Thank you for your question, Mr. Kraj, and thank you, CEO, for your response. Our next live question comes from Mr. Sunil Lala of TTT. Welcome and good afternoon, Mr. Lala. We invite you to unmute your microphone and present your question to the panel. Good afternoon, Mr. Lala. Are you hearing us? We invite you once more. For any persons who wish to present live questions to our panel, please raise your hand in the Zoom and we will acknowledge you. I see Mr. Lala has joined us. Mr. Lala, can you hear me? Good afternoon, Mr. Lala. Once more, we invite the opportunity for questions to our live panel here. Please raise your hand in the Zoom and we will acknowledge you. Well, thank you all for your questions and contributions this afternoon. Ladies and gentlemen, we have come to the end of the Q&A segment and our virtual meeting for the accounting period 2019 to 2020. We are indeed grateful for your sterling contributions. For our final act, I now wish to invite to deliver the vote of thanks the Deputy Chairman of the Board of Directors, Ms. Giselle McFarlane.
Thank you, Mr. Ganpath. Her Worship, Alderman Salima Thomas McCree, Mayor of the Borough of Point Fortin, Chairman of the SWARA, and members of the Board of Directors of SWARA, Councillor and Alderman of the San Fernando City Corporation, Point Fortin Borough Corporation, and other regional corporations, the Chief Executive Officer, executive managers and staff of SWARA, members of the public, members of the media, ladies and gentlemen, good afternoon. On behalf of the SWRHA Board of Directors and as Deputy Chairman, it is my privilege to move the vote of thanks to all those who have contributed to making this second virtual public board meeting a success. Please permit me to thank the Almighty God, for it's through Him all things are made possible, and without Him, all our successes, achievements, and inspirations for improvement noted here today will be insignificant. Furthermore, we would also like to express our gratitude to Annalisa De Pisa of the Policy Planning and Research Department for commencing this afternoon's proceedings with her inspirational invocation. Mrs. Valerie Allen Rollins, Chairman of the Board of Directors of SWRHA, we extend to you our sincere thanks for sharing with us the board's achievements over the past year, strategic goals and priorities of this RHA for 2021 and beyond, as well as your strategic leadership and direction to the board as we work towards achieving the vision of becoming the state-of-the-art health facility that we can be. To our Chief Executive Officer, Dr. Brian Amor, a consummate professional, public health specialist, and healthcare strategist, we are grateful for your comprehensive and informative presentation, providing the population with sufficient details on the performance of the RHA and many of our significant achievements, even during this dreaded pandemic. Thank you for your dedication and effective leadership. Our gratitude must also be extended to moderators, Ms. Michelle Marie Lafourcade and Dr. Sandy Arthur, who so eloquently may I correct this? Ms. Michelle Marie, Mr. Ganpat instead of Ms. Michelle Marie Lafourcade, and Dr. Sandy Arthur, who so eloquently ensured a smooth flow of this afternoon's proceedings, providing an easy transition from presentations during each segment. I also wish to thank all our distinguished guests, members of the public, who took the time to register and log into our second virtual public board meeting. Thank you for your contributions and queries on our progress as an organization. Your input is extremely valuable and important to us. Without your feedback, we are limited at evolving to meet your needs. Hence, we welcome and value your feedback, not only today but every day, as we believe that it is integral to continuous improvement. Even in the modern age of technology that may make life simpler, organizing a virtual public board meeting is not at all an easy task. Therefore, I must mention our heartfelt appreciation to the staff and the board secretariat, staff of the Board Secretariat, the Information and Communications Technology, Policy Planning and Research, Quality Improvement, Nutrition and Dietetics, and our Corporate Communication departments, and other staff members who work tirelessly in the foreground and background. Thank you for your roles in organizing this event. You deserve congratulations for a job well done. To the media, we thank you for your presence and look forward to your positive coverage of this event. And to corporate citizens who selfishly contributed to the cause, we thank you as well. In closing, I wish to express my gratitude to all our staff and partners who have contributed to the achievements, and I wish to implore you to continue to provide a quality, dedicated service you have so aptly displayed throughout this pandemic to all of the people of Trinidad and Tobago. Thank you.